Hello friends. Today we are going to discuss about the temporal and the infratemporal regions. So we have discussed about the norma lateralis, means we have studied the skull from the lateral aspect. So we have seen a zygomatic arch. Let me explain you one by one. So we are seeing the skull from lateral aspect. So here we can identify a prominent the bone called as zygomatic arch, which is separating the lateral part of the skull into two regions. Above one is temporal region, below one is infratemporal region. So here I have drawn a line just above the zygomatic arch. That region will come under the temporal region or temporal fossa. So let me explain you the boundaries of temporal fossa. So superior boundary, it is formed by the two lines. So when you observe the skull from lateral aspect, we can identify the two lines, but sometimes most of the times we will find only one line. So that line is inferior temporal line is prominent. Why? Because as it is giving origin to the temporalis muscle, which pulls the bony part more while you speak, while you eat. So that's why we can identify the inferior temporal line is prominent. Then superior temporal line is also present, but it is not as prominent as the inferior temporal line. So superior temporal line is forming the superior boundary of the temporal region. Then comes the anterior boundary. Here I have just put a heading like a superior. Let me, a small mistake. You can see the anterior boundary. It is formed by the two bones which are meeting with each other. One is the zygomatic process of frontal bone and frontal process of zygomatic bone, which are forming the anterior boundary of temporal region. Then comes, we have separated the zygomatic arch, which is the superior margin of zygomatic arch is forming the inferior boundary, and inferiorly it is communicating with the infratemporal fossa. And the floor is formed by the four bones. Anterior, we can identify the frontal bone, that is in a blue color. Then behind the frontal bone you can identify two bones. Above one is parietal, below one is sphenoid, greater wing of sphenoid bone, and most posteriorly this pink color one, that is nothing but the squamous part of temporal bone. And coming to the main feature of this floor of the temporal region. So the temporal region, we can identify H-shaped suture where the four bones are meeting with each other. The meeting point is called as pterion. Exactly at the level of pterion inside the cranial cavity, we can identify the anterior branch of middle meningeal artery. It is lying at this level. Okay, so here I have marked it. This is called as pterion, H-shaped suture. So what are the bones are meeting? Frontal bone, parietal bone, greater wing of sphenoid bone, and squamous part of temporal bone. Then contents. What are the contents of the temporal region? One is the temporalis muscle, which is arising from inferior temporal line. Then we can identify the temporal fascia, which is fusing with the superior temporal line. So the temporal fascia, it is going to split into two layers, and it is covering entire the temporalis muscle. It is extending down and reaches to the zygomatic arch, superior margin of zygomatic arch. Now I am going to show the temporalis muscle. Yes, here you can see that. Yes, temporal fascia we are seeing. So the temporal fascia, it is going to split, and then it is reaching to the superior margin of the zygomatic arch. So between the two layers of the temporal fascia, some structures are passing. Okay, and the temporal fascia or temporal fascia, which is covering the temporalis muscle, and this muscle will comes under muscle of mastication. So here you can identify the structures present in the two layers of the temporal fascia. Superficially, we can identify a nerve is running here. So that is nothing but the auriculotemporal nerve posteriorly, and anteriorly between the temporalis muscle and the floor, we can identify a pair of nerves. Here I have shown two arrows. They are nothing but the deep temporal nerves which are supplying to the temporalis muscle. Here you can see the auriculotemporal nerve. Then you can identify the artery, superficial temporal artery, which is also passing between the two layers of temporal fascia. Then what is the origin, insertion, nerve supply of temporalis? So the origin of the temporalis, it is by It is coming from the inferior temporal line. So inferior temporal line, how it is extending? So it is extending from the frontal process of zygomatic bone and the zygomatic process of frontal bone, where the two bones are meeting with each other, and from here it is extending posteriorly, and then it is running back and reaches to the supramastoid crust, where it is joins with the superior border of zygomatic arch. So from that, this temporalis muscle is arising, and also from the floor of the temporal region, means from the surface of lateral surface of greater wing of sphenoid bone and the external surface of squamous part of temporal bone, external surface of parietal bone, and external surface of the frontal bone. So from the floor bones, the temporalis muscle is also arising, and also from the temporal fascia, this temporalis is arising. Then coming to the insertion, it is reaching to the chronoid process of mandible, anterior border, posterior border, medial surface, and partly lateral surface. These four parts which are giving insertion to the temporalis muscle. Then we can identify the nerve supply of this is deep temporal nerves. Okay, the action, now we can identify the elevation of the mandible. Elevation of the mandible. Then the temporal fascia. So the temporal fascia, as we have discussed earlier, it is attaching to the superior temporal line, and superior it is blending with the third layer of the scalp, that is gallia aponeurotica, and then it is extending down. It is extending down and reaches to the superior margin of the zygomatic arch. Yes, here you can identify the temporal fascia, and then inferiorly extending towards the zygomatic zygomatic arch. Then it is going to split and passing the two structures. One is superficial temporal artery and the auriculotemporal nerve. So and then this temporal fascia, which is giving attachment to auricularis superior and auricularis anterior muscles. And the composition of the gap between two layers are: one is anteriorly, most anterior zygomaticotemporal nerve, and then we can identify superficial temporal artery and temporal vein, the superficial surface, which is giving origin to the auricularis superior muscle and auricularis anterior muscle. The deep temporal nerves, which are also they are present, deep temporal arteries and the deep temporal nerves, which are present between the temporalis muscle and the floor of temporal region. Then we can identify the other nerves are, you can identify, one is deep temporal nerve, then you can identify auriculotemporal nerve here. So that is about the temporal region. Coming to the infratemporal region, coming to the boundaries of infratemporal region: anterior boundary and posterior boundary, superior and the inferior boundary. Okay, let me explain about the anterior boundary. So the anterior boundary is formed by posterior surface of maxilla, and posterior boundary is formed by styloid process and its group of muscles. And superiorly we can identify infratemporal surface of greater wing of sphenoid bone and infratemporal crest of the greater wing of sphenoid bone. And lateral boundary is formed by the ramus of mandible, and inferior boundary, it is communite, it is open, it is open. Then we can identify, excuse me, yes, the muscles which are present here, they are the muscles of mastication. Then communications. So anterior it is communicating with the orbit through inferior orbital fissure, and medial it is communicating with the pterygopalatine fossa through pterygomaxillary fissure. Then superiorly it is communicating with the temporal region through this zygomatic arch. So it is a schematic diagram to show you how it is communicating. So anterior it is communicating with orbit through inferior orbital fissure. Superior it is communicating with the temporal region, and here posteriorly you can identify. Posteriorly it is open, inferiorly it is open, and posteriorly it is communicating with the styloid group of muscles. So that is about the infratemporal region. Then what are the contents of it? So muscles, vessels, and nerves. We are going to discuss about three structures: muscles, vessels, and the nerves. Let me show you the muscles. So the first one is lateral pterygoid muscle. So the lateral pterygoid muscle, it is having two heads. So the upper head, which is arising from infratemporal surface of greater wing of sphenoid bone, which is forming the roof of infratemporal fossa or superior boundary of infratemporal fossa, and the yes, here can not only from the infratemporal surface of greater wing of sphenoid bone, but also from the crest of the greater wing of sphenoid bone, and the deep head, which is arising from the lateral surface of lateral pterygoid plate, lateral surface of lateral pterygoid plate. So from two different parts, and it is having two heads. One is upper head, second one is lower head. So upper head coming from infratemporal surface of greater wing of sphenoid bone, lower head coming from lateral surface of the lateral pterygoid plate. And here you can see the lateral surface of lateral pterygoid plate, where it is giving origin to the lower head. So insertion, so it is forming a tendon, common tendon, and this tendon which is running towards the condylar process of the mandible. So we can identify anterior to the condylar process of the mandible, we can identify a depression called as pterygoid fovea. To that fovea, this lateral pterygoid tendon is going to insert. Yes, here you can identify the depression in front of the condylar process of mandible. The depression is called as pterygoid fovea. Yes, here you can identify the tendon of lateral pterygoid. Then you can identify what is the nerve supply of this and action. So nerve supply is by nerve to the lateral pterygoid, which is a branch of mandibular nerve. From which division we will discuss in the few minutes. So it is supplied by anterior division of the mandibular nerve. Remember what is this anterior division? I will let you know shortly in the next class. So the action we can identify. What is the action? It depresses the mandible, means opening of the mouth. Then by pulling forward the condylar process of the mandible. Okay. Then you can identify the protrusion of the mandible. Protrusion, combined action with the medial and the lateral pterygoid. So here you can identify the combined action of medial and the lateral pterygoid, protrusion of the mandible. And the relation. What are the relations? Superficial relations are, one is it is related to the ramus of mandible. So we are coming from outside to inside, outside to inside. First one is the ramus of mandible. Ramus of mandible, it is having two process, coronoid and the condylar. Somehow it is going to reach the condylar process. So we can identify the coronoid process where it is giving attachment to the temporalis muscle outside to the ramus or lateral surface of the ramus, which is giving insertion to the masseter muscle. So when you go outside to inside, it is related to the origin of the masseter and insertion of the temporalis. Then we can identify, so we have separated the masseter, then temporalis, we have separated both. Then you can identify the superficial head of the medial pterygoid muscle. Then we can identify the maxillary artery. Maxillary artery, it is also the superficial relation of the lateral pterygoid muscle. Then we can identify the vessels, what are the branches on it, we'll discuss later. Okay, so the deep relations of the mandibular nerve and its branches. Okay, and middle meningeal artery. Then the ligaments, it is relation or sphenomandibular ligament and the deep head of medial pterygoid muscle, and structures emerging at the upper border. So it is having two heads. From the upper border of the lateral pterygoid, some structures arises. So the first nerve, first structure which is arising from the upper border of the lateral pterygoid is the deep temporal nerves. Deep temporal nerves. Then structures emerges at the lower border, or we can identify inferior alveolar artery, and inferior alveolar nerve, and we can identify the lingual nerve and also the deep auricular artery, and structures passing through the gap between the two heads, or one we can identify, excuse me, between the two heads, or we can identify the third part of the maxillary arteries passing between the two heads. Then you can identify the buccal branch of the mandibular nerve. Okay, so there are the two structures which are emerging between the two heads of lateral pterygoid. Then coming to the medial pterygoid muscle. So it is a thick quadrilateral muscle. Thick quadrilateral muscle. It is having two heads. One is superficial head and the one is deep head. So the superficial head arises from the superficial head arises from the posterior surface of maxillary tuberosity. Posterior surface of maxilla, we can identify maxillary tuberosity from where the superficial head of medial pterygoid is arising, and the deep head coming arising from the medial surface of lateral pterygoid. Medial surface of lateral pterygoid. Both muscle fibers, they are running down towards the ramus of mandible, medial surface of the ramus of mandible. Behind the mandibular foramen, it is going to get insert. That is about the medial pterygoid. And here it also arises from the palatine process. So palatine process, pyramidal process of the palatine bone. Okay, and insertion, it is about, I have explained about the ramus of mandible, behind the mandibular foramen, and the groove, mylohyoid groove. Yes, here exactly. Then you can identify the nerve supply. It is by nerve to medial pterygoid. Superficial relations are, we can identify the posterior division of the mandibular nerve and the anterior division, and then you can identify the maxillary artery, and then its branches. Then you can identify superior pharyngeal constrictor. I will show you all the things. Tensor valley palatini. Then you can identify levator valley palatini, superior pharyngeal constrictor, styloglossus, and stylopharyngeus. These are all the relations of deep relations of the medial pterygoid muscle fibers. Actions are, one is elevation of the mandible, and side to side movements, protrusion and side to side movements. So that is about the temporal and infratemporal fossa. So in the next class, we are going to discuss about the maxillary artery and its branches. In the last video, I'll explain about the mandibular nerve and its branches. Thank you, friends.